Hello everyone, this is Sun Beibei. Welcome to my topic about association between HbA1c levels and intracranial atherosclerotic plaque enhancement patterns using high-resolution MR-VWI image. Intracranial atherosclerotic stenosis is the most common cerebrovascular lesion in China. Diabetes mellitus have been correlated with presence of ICAS and the occurrence of ischemic stroke in previous study. HbA1c has long been used as a marker for the glycemic control in patients with DM and in patients with prediabetes, are also associated with cardiovascular disease. Our previous MR study have demonstrated high HbA1c was related to the vulnerability of carotid plaque, especially lipid-rich necrotic core and large plaque burden. It is expected that ICAS could be more susceptible to blood glycemic control, but there are few studies about the influence of glycemic control on the progress of ICAS with high-resolution vascular image. This study was designed to assess the relationship between recent glycemic control and the characteristics of ICAS in acute stroke patients. This is a flowchart of our study. Patients with acute ischemic stroke in anterior circulation with a target interval less than 28 days preceding HR-MRE were prospectively recruited. 43 were included according to the inclusion criteria. 78 patients with symptomatic plaque in MCA were left for our final analysis. This is a definition of symptomatic plaque in MCA, the only lesion within the vascular territory of the stroke. All the most stenotic lesions when multiple plaques were present within the same vascular territory of the stroke. Then the qualitative parameters and the quantitative parameters were measured. This is our results. The Table 1 shows the baseline data of symptomatic MCA atherosclerotic plaque or patients according to HbA1c. We can see the patients with high HbA1c have more hyperlipidemia, especially high LDL level, than lower HbA1c patients. The Table 2 shows the MR image finding of symptomatic MCA atherosclerotic plaque of symptomatic patients according to HbA1c. Patients in high HbA1c group showed greater prevalence of plaque enhancement, especially grade 2 enhancement pattern, than low HbA1c group. And patients with high HbA1c have a significantly higher enhancement ratio than patients with low HbA1c. The Table 3 shows the association between HbA1c and symptomatic MCA plaque grade 2 enhancement. After adjustment for the significant demographic factors, HbA1c level was independently associated with grade 2 enhancement pattern. And the Figure 1 shows the ROC curves of differentiate patients with grade 2 enhancement pattern. The cutoff value of HbA1c to differentiate grade 2 enhancement pattern was 60.1. The Figure 2 shows the example case of high and low HbA1c people with different MCA plaque enhancement pattern. A to C figures show a right MCA grade 0 enhancement plaque with moderate stenosis of lower HbA1c patients, and the cerebral stabilized demonstrate no acute cerebral infarct. D2F show a right MC grade 2 enhancement plaque with severe stenosis of high HbA1c patients. The cerebral destabilized demonstrate a large volume of acute cerebral infarct at the right hemisphere. From our study, there are two implications for patient care. The first one is elevated HbA1c may have an adverse effect on MCA atherosclerotic plaque grade 2 enhancement. Second is a high level of HbA1c is indicative of vulnerable intracranial atherosclerotic plaques, which may be useful for the prediction of stroke in patients with intracranial artery disease. Thank you for your attention.